Hello, everyone. It's me, Dr. Marty Ross. Tonight is another one of our conversations with Marty Ross MD. I'm sitting in Colorado Springs right now in my camper van, so that's why you see the background like you have. I'm visiting my father, and we'll be heading back down to Austin tomorrow. So anyhow, that explains the surroundings here a little bit. So the way that these webinars work is I'm having people write questions to me using the chat box. And I ask that when you, with the chat box, that you only actually use it for writing questions to me. If you provide other comments in there back and forth, it kind of clutters that up and it makes it a little bit harder for me to follow. So that would be my main request there, is that you use it mainly to write your questions, okay? Um, what I will do is I'll pretty much take these one at a time. And as we're doing the discussions, I'm answering the questions. I may ask the person that wrote that question some qualifying questions, or I may ask you, did I answer the question you wanted me to answer as well too? The reason I have you write your question first is I find it makes it so we can get through more questions during the night. Okay, so because that we take the time away from having to do that. I will read the question out loud, but if any of you want to follow the questions, just look at the chat box. You'll see what I'm reading there. Okay. And then I am creating a recording of tonight's webinar, and tomorrow morning I will announce to everyone or you'll get a notification when I post the recording. It will be posted in the Zoom recording section of Lyme United. And if you're wondering where that is, on the left-hand navigation menu, at the bottom of the left-hand navigation menu, it says Zoom recordings, and that's where I post it, okay? My intention is to have the recording as well as a summary of key topics that we discussed in that recording ready for you by around 9 to 9:30 a.m. And I'll call it Mountain Standard Time because that's where I am right now tomorrow morning. So just look for that. So if you happen to miss something, it'll be there. Okay. All right. And then I think that's it for my background here. Why don't we? Oh, and then one last thing. I know that I was off for a couple of weeks. A lot of that was due to timing of the holidays, and so this month we have 3 of these webinars scheduled. I am going to be at a conference the 3rd week, I think, of January, so that's why you don't see one scheduled there. But we do have 3 coming up this month. Okay, so we have 2 in a row, a week off, and then the last the last Thursday, we'll have one of these as well too. All right. So without any further ado, why don't we go ahead and get started here? First question, I believe, is from Deborah K. And Deborah says, I've had body jerks so strong, my entire body jerks off the bed. It's when I'm almost asleep. What would cause this? Could IVC and UV ozone do this? It's a good question. So I guess a couple comments. Number one, it's very common, even in people that don't have tick-borne infections, to have jerks as they fall asleep, as they start to go through the stages. We call those REM, rapid eye movement levels of sleep. So it's not uncommon as a person is starting to go to sleep to have some periods where you might have a kick or some motion, okay? But if it's happening in a severe way, that may also indicate that you've got some neurologic irritation that's even making it worse. And the things in tick-borne infections that can lead to more neurologic irritability in your brain and of your neurologic tissues would be Bartonella can do that, Borrelia, Lyme can do that, mold toxicity. If you happen to have mold toxicity, that can be an exacerbating factor as well too. So what you want to do is to get that inflammation and the irritability of the nerves down. And the ways to do that are to kill your germs, and that's going to take time. And the best ways to kill your germs are to use either herbal or prescription antibiotics, okay? All right. The second thing to do is to try to calm the inflammation down that's leading to irritability. And when you have tick-borne infections and when you have mold toxicity, the major inflammation is caused by your white blood cells reacting to these situations. And your white blood cells make a group of inflammatory chemicals called cytokines. And so you want to work to lower those cytokines and control those cytokines. And one way to do that is to work with curcumin. Curcumin gets inside of your white blood cells and it interrupts the production line where cytokines are made. So curcumin is a component of the seasoning turmeric. You have to be careful of the type of curcumin you use. You want to use a brand that is formulated to be well absorbed. For that, I recommend the Thorne product called curcumin phytosome. It's formulated to be well absorbed. The second thing I would do to help calm those agitated nerves is also work with glutathione. And glutathione is a very strong antioxidant that is made in every one of our cells. It is made to actually repair damage. And it can repair damage from the inside of those cells. So it can help repair damage to your nerves that are making them more irritable. In addition, it works, it interrupts oxidation signals by your immune system that tell your white blood cells to make cytokines. So in terms of interfering with these cytokines, I've talked about curcumin. Curcumin works on the inside of white blood cells, but you want to block the message going to the white blood cells. And what does that is going to be the glutathione. So glutathione gives you two benefits. It can help start healing those agitated nerves from the inside. And the second thing that it does is it blocks the oxidation signals that are telling your white blood cells to make those cytokines. You want to use a form of glutathione that has some track record or science that says it is absorbed. The product I like using mainly because they have great science showing good absorption. Like when you take it, you get a 40% increase in your glutathione in your red blood cells. They have science that shows that. And that is Research Nutritionals has a product called Trifortify. And I like to have people take a teaspoon of that one time a day. Okay. And then finally, sometimes when your nerves are really irritated like this, sometimes you have to work with herbs or prescriptions that will increase the level of a chemical called GABA in your brain. GABA will attach to neurologic receptors in your brain called GABA receptors, and that can calm agitated nerves down too. And so one great way to calm those or to increase GABA in your brain is to work with an herbal medicine called L-theanine. That's L-theanine, Theanine. Theanine is a chemical that's found in green tea, but it's not caffeine. Okay, so it's not going to hurt you anyway that way. And what it does is it does two things. First of all, a lot of it in the brain is converted into GABA. The second thing that L-theanine does is it calms the electrical impulses of the nerves directly in the brain as well too. It comes as a 100 milligram pill. And what you could do is about an hour before you go to bed, you might want to take some. It will actually aid in making you sleepy, but it will also decrease the agitation of those nerves. Okay. All right. So what I've talked about here is you need to calm down your nervous system agitation. All right. And one is treat your infections, remove mold toxicity, but also lower the cytokines that are made as part of this whole thing. And that would be to use curcumin and glutathione. And then finally, you can calm the agitated nerves directly by increasing GABA levels, and that's to use the L-theanine. Okay. All right. So Deborah, do you have any follow-up questions to that at all?
Well, what I had done, and I had majors. This went on for a while. Sometimes they'd be twitching, but then the jump jerking seemed to be something different. A neurologist told me that.
Yeah.
But it got to the point where I could do it for 2 hours, the twitching.
Yeah.
And off the bed. It was horrible. But then I had surgery.
I was just going to say a quick comment. That sounds like more than the normal sleep jerk that some people get. So just to clarify that. Yeah.
2 hours. And then I had surgery and I was told to go off everything. I had major surgery for cancer. And I don't need chemo or radiation, I'm told. But anyway, just an estrogen blocker. Good. And I'm going to look into an oncologist that does integrative medicine. So I was to go off everything. And then my Lyme doctor said, she's not on the Lyme doctor list, but she has it. And she has a lot of Lyme patients here in Pennsylvania. Right. And she said, try one thing at a time. And nothing correlated with the jerks, but they pretty much stopped. But they stopped when I stopped the IVs too. Because I was told after cancer, to go ahead and take the IVC. and
Right.
I could hardly walk, whatever it did to me.
Oh, let me make a comment on that. So your IV vitamin C and your UV ozone are strong oxidizing agents. Now, some people use them because they believe they kill germs. All right, that's one reason people use them, okay? The trouble is that they are potent oxidizing agents. And so in tick-borne infections, you're already making too many oxidation agents that are injuring your nerves and your mitochondria and everything else. The last thing you want to do is actually put more oxidation agents in there. So it could be the vitamin C and the ozone may have done two things. One is they may have led to more oxidation, injury to the nerves, and irritability to the nerves. Okay. The other thing, when we look at IVs, vitamin C and UV ozone, they are oxidizing agents that may kill germs, although there's science that says they probably don't do a great job. If you take a test tube full of germs, you put ozone in, you'll kill all the germs, okay? But if you take the same test tube, and they've done experiments doing this, and you put a small drop of blood in, and then you put the ozone in, no killing of the germs at all. And that's because your blood is rich in oxidizing antioxidants that neutralizes the killing effect. But ozone and vitamin C may still be able to get at viruses in that kind of a situation. And killing viruses that we cohabitate with can lead to more cytokines to be made temporarily as well too. So it could be that you were either having some killing effect leading to more cytokines, or a direct irritation of the oxidation from the vitamin C or from the UV ozone.
Okay, my mind got clearer, but the jerks got worse.
Yeah.
So I thought once in a while I'd try the C, just
Yeah.
for my brain.
Yeah. I got it.
Yeah.
I got it.
Okay.
Yeah. Anything else then?
No, that's it. Thank you.
Okay. Yep. Sandy, I see your hand up there. Is this pertaining to the question?
Yes, it is.
Okay. Yeah.
She was asking about ozone.
Right.
Would HBOT have the same effect, the hyperbaric oxygen, as the ozone that she's taking, or is that a
Yeah.
totally different effect that
Yeah.
it would have?
Yeah. So let's talk about two things about HBOT. So HBOT is when you get HBOT, you're getting 100% oxygen under pressure, okay, hyperbaric pressure, and you're breathing in 100% oxygen. In theory, and that oxygen may have two effects when it's under pressure. One is it could potentially kill germs, although based on the experience of Lyme doctors about 12 years ago, many of us were putting hyperbaric tanks in their offices. In the end, we just found miserable results from a germ killing standpoint. So in theory, it might, in reality, probably not a great germ killer, okay? But the other thing that hyperbaric oxygen does that's different than the IV vitamin C and the UV ozone is the hyperbaric with oxygen. Oxygen gets forced into your mitochondria, helping your energy factories called mitochondria, helping them work better. In addition, especially with neurologic tissue, you can get healing of neurologic tissue when you have oxygen under high pressure. So from a neurologic standpoint, it could help heal. It's going to operate in a different way than what an IVC and a UV ozone would. Did that answer that for you, Sandy? Okay.
Yes,
all right.
Yes, it did. Thanks.
Oh, okay. Very good. Very good. All right. Why don't we move on then? Let's see here. Get rid of that one. Okay, so hi, Al. Let's see. Lyme disease and co-infections left me with severe neurologic and headache issues and chronic mild leukopenia, neutropenia that tended worse for a few years but stabilized thereafter. Their neurologic issues are getting somewhat better with treatment, but the white blood cell neutrophil count hasn't budged, and it's been almost 2 years. What investigations would you suggest? And are there any particular tick-borne infections that are known to cause leukopenia and neutropenia? Do tick-borne diseases always reduce white blood cell neutrophil counts as part of their immune suppression? So, in terms of white blood cell suppression, it's common, although it doesn't happen in everyone, but it's common in Borrelia. I see it often, which is Lyme. Bartonella, I've seen it occur, and I've had it occur in Babesia. I usually think of it occurring more when Borrelia is present, though, okay? Why it happens, I haven't seen a good explanation. I haven't seen a good scientific study telling me why that happens, but it is very common that we will see that when somebody has active tick-borne infections, especially Borrelia. It doesn't happen in everyone, but it's common. We do know, even though I said I don't have a solid scientific explanation, we do know that Borrelia does release chemicals that can lead to immune suppression. So we presume that's probably what it's coming from, all right? And often what you will see is as you treat somebody with their chronic tick-borne infections with, herbal antibiotics, prescription antibiotics, and you work on getting cytokines down, you do all the things that I talk about in the Ross support protocol. As you get the germ load under control, you will see that the white blood cell counts start to come back up. In terms of specific studies that you need to do, I usually don't. I just follow the white blood cells and see that they're going to start getting better over time as we treat. Okay. Al, did that answer your question for you?
Yeah, that was very comprehensive. Thank you so much.
Okay, yeah, thank you. Does anyone else have a follow-up question there? Okay, all right.
Hello?
Yeah, hello, Emily. Let's see here. Oh, Monica, did you have a follow-up question?
I do have a question because I've only just come on in the last 5-10 minutes. I may have missed any answers you may have given earlier. Just regarding this product, I don't know.
Oh, yeah. So, Monica.
Yes.
So let me answer that. So what I would have you do. So the way that I try to do these question and answer sessions is have people actually write the question to me, and I take them in order that they've gone ahead and written them. Okay.
I've tried to find the place to do it. I couldn't find it this morning. I've been able to do it before.
Yeah. So all you need to do is click on the chat box at the bottom of your screen. Click on chat. Yeah, and just if you don't have to write out the whole detail, just write, Dr. Ross, what do you think of the Tick-Plex or the tick formula there? And I'll be glad to answer that for you a little bit. Okay.
That's all I need an answer to, and I just want to know if it's going to be strong enough to be effective.
And I'll answer that later on.
Thank you very much.
Okay.
Cool.
All right. All right. So Emily's up next here. So hi, Emily. Let's see. Hi, Dr. Ross. It's me again. Pregnancy questions. Happy to come on live. A couple of questions. My recent Babesia IgM retest came back positive, but the immunoblot IgG was negative. Should I consider myself positive for Babesia still? 2, I was on azithromycin, atovaquone, and proquinol for 6 months, with 4 of these months being daily and the first 2 pulsed. I have started getting GI symptoms and wondering if you would recommend pushing through the side effects and staying on the meds, or just sticking with an herbal protocol at this point. We're hoping to conceive as soon as it is safe possible given my chronic illnesses. And 3, which IGeneX test do you recommend for Borrelia, rule in, rule out? Okay, all right. Let me just do a quick, let's start with question number 1 first. So with all of the tick-borne infections, there is not an adequate test that you can do to tell you where you are. And in fact, we find that in the course of testing that your IgMs and your IgGs may come and go. All right. So the fact regarding these antibodies, we know with Borrelia that people can have chronic Borrelia and still make IgMs. There's good evidence from 3 NIH studies that were done about 20 years ago on using long-term antibiotics to get into those studies. People that had failed treatment had to be tested, and 50% still were making IgM antibodies. All right. So everyone, IgM antibodies are what you make in an acute infection, and they're supposed to go away by around 6 weeks or 3 months in most infections, and then they get replaced by IgGs. It appears in Borrelia that does not happen. There is some case study reports suggesting that in Bartonella, sometimes IgMs do not go away either, or may come and go. And there are limited reports that may happen with Babesia. So I don't get too hung up on what happens. Once I've made a diagnosis of Babesia based on either an IgG symptoms or an IgM in symptoms, I never go back and recheck again. We don't have a test that tells us if we're done. Those antibodies may come and go during treatment. They If your germs are hiding and you have a lot of immune suppression, they may go away. That doesn't mean the germs are gone. It just means your body isn't making them in that instance. And there's studies that tell us they come and go during treatment, and they may still stay on even after the germs are gone as part of your ongoing immune response. Okay, so I don't recheck because there's no studies that tell us that retesting is an accurate indicator as to whether the germs are still there or gone. Okay, so I hope that answers part one for you there. In terms of, let's go to number 3 then, because we'll stay on the testing questions here first. All right, so in terms of ruling in Borrelia, when you're talking about trying to find whether you have laboratory evidence of having an infection, what you're most interested in is the testing technique that is what is called most sensitive. Sensitivity means what is the ability of this test to find an infection when it is there. Okay, that's what sensitivity means. And usually and the way that this is determined is before a test is ever offered for sale or an independent lab offers it in their lab, they're supposed to get samples, preferably from the Centers for Disease Control, that the CDC will send them blood samples that have the infection and some that don't. And you're supposed to go ahead and see how good are you at determining that, okay? So of all the tests that we can do, IGeneX's immunoblot test method, I should say, is proving to be one of the most sensitive for the 3Bs, all of them. And for Borrelia, it appears it is 95% sensitive at determining Borrelia, okay? Of all the other testing techniques, there isn't anything that probably comes close to that. Keep in mind, the immunoblot is measuring whether you're making antibodies that attach to certain cleaned up proteins, so the Lyme germ. Okay, so we could call it an indirect test. It's measuring, do you have an immune reaction against this infection, all right? All right, there are also what are known as direct tests, which are ways of seeing, do you actually have the germ in you, like doing a culture or measuring the genetic material, doing a PCR test, or doing a type of test called a FISH test where we apply a fluorescent marker to the genetic material of the germ. These are all direct tests. The trouble with direct testing in chronic tick-borne infections is we have no idea of knowing how sensitive they are. We do know, well, I should say with Borrelia and Babesia, we don't have good testing telling us how sensitive they are. We do know with Borrelia, and a lot of testing, looking at this idea of sensitivity in PCR testing in Borrelia, it only appears to be 30% sensitive. All right, so our direct tests are not good for these infections at all. All right. Now, the one thing about the direct test I would say, though, is if you are looking to see, are you done with treatment, and you get a direct test that's positive, well, it's still in you. But because the sensitivity may not be that good on these direct tests, a negative test does not mean it's not in you, basically. Okay. All right. All right. All right. And then let's see here. Let's see. You were on azithromycin.
One follow-up question about that, if that's all
Sure.
right.
Sure.
Because
Yeah, go ahead.
I'm getting drawn for some collection of IGeneX tests, and my doctor is kind of thinking of a few different ones to run. And obviously your lab runs up pretty fast, but because we're headed towards pregnancy and because it can be congenital, I definitely want to have whatever comprehensive testing preventatively. Right. So is the immunoblot test through IGeneX, is that like what it is called? Will my doctor kind of know exactly what that means if I say that? And then do you think it's worth it in my case to do any of the direct tests, or are those just kind of not really important to throw into the mix?
Yeah, if you wanted to have, all right, so often when I'm recommending testing, I'm trying to keep the price tab in mind because you can run up, okay?
I know.
Let's set aside the price tab. Let's just answer your question, which is, what is going to give me the most thorough way of looking at this, okay? In that situation, I would do the immunoblot because it is the most sensitive.
Okay.
And I would try to pick one of the direct tests. And I think probably these days, one of the better direct tests, IGeneX has come up with what they're calling an enhanced qPCR, which is they draw your blood, they put the blood in a medium that helps grow more of the germs, and then they come in and do a PCR test behind it. All right, so it's their EQ PCR. They call it culture, but it's an EQ PCR. The trouble is, again, with that, we don't know how sensitive it is, but the fact that of all the direct testing, they're trying to at least increase the chances of finding it by culturing it for a while. That probably has, in theory, would have more sensitivity than any other direct methods. All right.
Okay.
So
Great.
there is, here in a bit, after I answer your next question, I'll go ahead and show you my article on testing, where I talk about the specific test numbers for the immunoblot.
Okay, perfect.
Yeah. Okay. All right. I'll show that to you here in a minute. Yeah. All right. And then finally, let's see. I was on azithromycin and atovaquone proquinol, which is also known as Malarone, everyone, for 6 months, with 4 of these months being daily, and the first 2 were pulsed. Oh,
Sorry if
so
that's confusing. 6
no,
months
let me
altogether, the first 2 were pulsed by 3 to 4 days, and then the last 4 were not pulsed.
Okay, so I want to clarify. You mean azithromycin and your Malarone, you pulsed every 3 days for the first 2 months?
In the beginning, that was my doctor's recommendation. Then I sort of had a new, realized mostly through your work and a couple other people that might not be the best.
Right. Okay, and then let me clarify one other thing with you then. Were you, in terms of your Babesia, did you have actually laboratory diagnosis, or was it a clinical based on symptom diagnosis?
It was based on tests, testing through IGeneX.
Okay.
Yeah.
So you don't actually have a way of knowing. So sometimes when people have a lot of symptoms of Babesia, we can track what happens. And if their night sweats go away, their air hunger goes away, they stop having excess deja vu experiences, that sometimes gives us a clue that clinically we're done. You don't have any of that to go on. Is that correct?
I feel less sick in a variety of ways. I had also tested positive, or like borderline positive, for Bartonella, and was treated for that. But I also have POTS and hypothyroidism. So it's kind of like there are so many things going on at once that it's kind of hard to identify exactly what the symptoms are related to sometimes.
Okay.
But
And then
I have a lot less brain fog, a lot less fatigue, more energy after this treatment, for sure.
Okay. And then when you say you're having GI symptoms, what kind of symptoms are you having?
It's just like for the first 6 months, I really didn't have any side effects. And now I'm just getting that kind of stomach cramping feeling and having more gas, and just it feels like more upset more of the time. I also 4 weeks ago added in the CSA herbal tincture and Japanese knotweed. So I'm on a variety of things.
Are you taking any probiotics, or are you on any probiotics, and are you doing any yeast killers at the same time?
Oh, that's interesting. I don't think I'm on any yeast killers, or I haven't been told that. I am taking metabolic daily because I saw your recommendation for that. And then I also take, I think it's called Restore Flora. Another one. And I take like a yogurt, like a cultured yogurt.
Okay.
Yeah.
So you're getting, when I start hearing that gasiness and bloating, just as you're probably thinking, with being on the azithromycin, it's gonna tend towards disturbing the healthy gut microbiome. Being on probiotics is one way of reversing that, but still, with that, sometimes you get increased yeast. Actually, is the main problem people get. Here's what I would suggest to answer your second question. I think and I know you're hoping to get rid of this before you get pregnant, right? So I want to optimize that chance. Okay.
Right.
So I would look at, if you were my patient, I were treating you, and I know you're going to talk to your doctor about this. I would probably try to be at least on 5 months straight of your azithromycin Malarone. Okay. Even though you've added in the CSA. Okay. But because that may disturb your gut more, definitely stay on your metabolic daily, definitely stay on your other probiotic you're on. But I would I would consider adding in either prescription nystatin at 2 pills twice a day. Now, nystatin is a prescription, but it stays in the intestines. It's not absorbed. It's not going to get into your bloodstream, so it has no toxicity that way,
Okay.
or go with an herbal antifungal, anti-yeast medication. One product I carry at my store that I've had good success with is something called Capri Plus. It's CAPRI+, all as one word. It has in it garlic, oregano oil, and caprylic acid. And you would do a couple pills twice a day. You may be just starting to get into a little bit of, usually what I see with this, that usually indicates a little bit of yeast overgrowth is starting to come on.
Okay, interesting. And then if the retesting isn't really how you determine if you're negative, and the symptoms that I'm having could be a variety of things, how, if you were me, would you make the call of like, it's good enough treatment in order to not be on treatment anymore?
Boy, that's a hard one.
I know. I'm like, probably that's a very complicated.
Yeah, it's complicated. The best you can do is try to have given a good go of trying to get rid of it by doing a 5-month treatment. And with a good treatment, and you've done that. And there's nothing ever 100%. And I know you're trying to prevent it going to your baby and everything, but that's where I would go with it. Basically, is give it a good go, and you've done a good go with it there. Basically,
awesome. Thank you. I really appreciate your time.
Yeah. Does anyone, and Hong, I see your hand up there, but so Hong, do you have a question about what Emily was asking here, or is this a separate question? Oops, your microphone's muted there. There. Oops, I am not hearing you at all. You might want to check your microphone setup to make sure you've got your computer set as your microphone.
Hi, can you hear me?
There you go. Yeah, now we can hear you. Yep.
Oh, I was saying I don't have questions about this right now. I just have questions for myself, and I just want to make sure I'm in the queue. Do I have to raise the hand, or do I use the comment? How do I get in the queue?
So you are in the queue. In fact, you're my next person. So if you wrote your question in the chat box, and you're in the queue, and actually you're up after Emily is. So yeah, okay. I'll come back to you just a minute here. So does anyone else have any follow-up questions what Emily was asking though? All right, let's go ahead. So Hong, let me just read your question here. I'm gonna read it out loud and then we'll get into it here. Let's see, I've been taking the treatment for about 2 months. I'm still herxing, although I'm herxing less. How long will the herx last? I take the herbs in the evening and wake up feeling the herx, like pain, fatigue, headache. How do I know these herx will eventually go away? Need some encouragement. I take GABA directly before bed. You said L-theanine. Could you please comment on the white lesion on my brain MRI scan? Okay, so a question for you, Hong, so that I can understand this a little bit better. So it gets to be difficult to determine specifically what is a herx and what is just the natural stuff that goes on from still having germs in you. Okay, I'll just make that as a starting comment. But are you taking anything to lower cytokines like glutathione or like curcumin? Do you have any of those in your protocol at all?
I have some of that. I have mast cell activation triggered by the tick-borne infection. So I take ketotifen, I take boswellia. And I'm going to take NAC a little bit more consistently. So
have you tried glutathione at all though, or not?
I've tried glutathione IV, but not. Maybe I should add glutathione.
Well, here's what I would suggest. Okay, so let me just talk about cytokines real quick. So cytokines are made by your white blood cells when they see an infection or they see a toxin, and they have a good and bad parts to them. Good side is when they get made by white blood cells, they're made to help bring more white blood cells to where the problem is, help those white blood cells work better, and they tell the immune system to make more white blood cells. That's all good. However, in chronic tick-borne infections, chronic mold toxicity, the immune system often doesn't doing a good enough job, and it keeps trying harder and harder, and eventually it makes too many cytokines. And too many cytokines give you brain fog, make you hurt all over, give you fatigue, et cetera, all those symptoms that we call mold toxicity and chronic Lyme symptoms are excess cytokine symptoms. The majority of them are. Okay. All right. So just make sure we're on the same page there. So as part of treating, and then the other problem with excess cytokines is they can suppress your immune system too. Even though they're being made to help your immune system, in excess, they can suppress your immune system. So you want to try to lower those cytokines down. And then when you start killing germs, the immune system will see more of those dead bug parts and make more cytokines. So I agree, the way that you're worse after you take your antimicrobials, that still suggests you're having some herxing going on, okay? And so what I would suggest is getting stronger at trying to keep those cytokine levels down. And knowing that you have mast cell activation, what I might consider doing is working with quercetin instead of curcumin. Quercetin and curcumin both get inside your white blood cells and interrupt the production line for cytokines, okay? But quercetin has another advantage in that it is a very strong mast cell stabilizer, which will help keep some of your histamines under control too. So you get two things out of it, all right? So I would go with quercetin. I would try to take 500 milligrams 3 times a day, which again is going to help mast cells. It's going to help cytokines. And in addition, I would try to raise your glutathione. The strongest way to do that is to take it as glutathione. And I would work with I like the Trifortify product because it's well absorbed. And I would do a teaspoon of that once a day, or probably less well absorbed, maybe not quite as active, but more cost effective, is to take N-acetylcysteine, NAC, which is a precursor for glutathione. It helps make more glutathione. And you would do 500 milligrams 3 times a day. That can lead to more glutathione. So what I'm proposing for you is get stronger on your cytokine control, okay? And that may help so you're not having quite the Herx reaction. And in addition, you're going to be bringing down that level of cytokines that you have in you as well too, okay?
Where do I get the glutathione, the liquid form?
Yeah, I'll show you in a minute. In fact, I still have to go back and show Emily the article on testing too. We'll do a screen share here after I get done answering your question here, okay? And then let's see here. Well, I mean, to briefly answer your question, anything I suggest, I carry at my supplement store. So at Marty Ross MD Supplements, if you're looking for a source, that would be a place to go ahead and get those, okay? And just so you all know, I price my products at the lowest amount the manufacturers let me price them. If I could go lower, I would. They just don't let me go any lower. And then I provide free shipping and I cover any taxes. So I try to make it as low as I can, as I feasibly can. Okay.
Yeah.
All right. So then,
I love your stuff. I love all the things you have in the store.
Great. All right. And so then, tell me about this, the white lesion in your MRI scan. Can you tell me? Do you have any idea what part of the brain they saw it in, or can you describe it a little bit more?
It's the right side. Right side. Yeah. So it's like a little bit to the side. Yeah. Not exactly in the center.
Did the radiologist report that he thought it looked like it was demyelination at all, or did they say anything about it at all, or not?
They attributed to like my age. Like they said, oh, it's nothing. Old people get that. But the fact that my brain hurts, my head hurts all the time. I figure it probably has something to do because most of my herxing is here. I think I have more of a neurolyme that my body, well, it used to be all the joints, even the knuckles hurt and swell, but that is gone, right? So, but I have this like shoulder up problem.
Okay. Usually a specific small white lesion, Lyme is going to give you more a pattern that is going to suggest demyelination. It's going to be more diffuse. It's not going to give you those single solitary nodules like you're describing. Usually it will not. Okay. And those kind of nodules you're describing, actually, they can't be part of aging, unfortunately. It happens that part of your brain may have had a limited blood flow in that section for whatever reason. So we can accumulate those as we age. That's the best I can say without actually being able to read the MRI report myself. Okay. But usually when a solitary lesion, I'm not thinking Lyme as being the cause of that.
Okay.
All right.
And then in terms of herxing, like what's the expectation that I would feel like I am herxing much less. And what's the
So,
expectation?
yeah. So generally, you know, as you lower your germ load down, you will over time not herx anymore, even as you're still killing germs. Okay. So keep in mind that not herxing does not mean you're not killing germs. So let me clarify that even further. There are probably about 15% of people in my practice that, as I was treating them, never herxed on anything. All right. And so, you know, the trouble with tick-borne infections is you're spending forever getting better because sometimes it takes months to get better and you're not herxing. And so you start wondering, a person starts wondering, is this working? Right. But yeah, it does work. You don't have to herx to get better. There are some people that herx more easily than others. We don't know why. It seems you may be in that kind of category. I would just expect that probably over the next 2 to 3 months, that should start going away.
Sounds good.
All right. All right. Good luck to you.
Thank you.
Does anyone, I see, Kelly, I see your hand up there.
Yes, can you spell the mast cell regulator that you were talking about?
Yeah, it's called, yeah, so here, I'm going to do a screen share here. I'm going to show you guys some stuff. Let's see, share screen. All right, so when I do these screen shares, I got to move things around on my screen so that I can get at things I need to here. Okay, so here's my supplement store, and the quercetin, I'm spelling it here, and I'll show you the product for that. Okay, this is the quercetin product I recommend for this purpose. Okay, it's a Thorne product. All right. And then you mentioned about the glutathione. The product line that I like is made by Research Nutritionals, and it's called Trifortify. They have a number of different sizes. The reason I like this is they've got compelling, small study, but they've got some studies done showing decreased oxidation of fatty acids and the cell membranes, and also marked increase in blood levels when you take it. It actually is absorbed. Okay. So any of these sizes would work for you there. And then
hold on before you go. Is that the Trifortify watermelon one?
Yes.
Okay.
Yep.
Hold on 1 second.
Okay.
Let me do a screen grab. Okay, thanks.
Okay. All right. And then back to the what test question here. Emily, I think. Let's see here. So all right, so this is the article where I talk about what the best test is and why, and I talk about sensitivity. It's called, what do I call it here? The best lab and test for Borrelia, Bartonella, and Babesia. And then down in here, I talk about the immunoblots and I tell you which test numbers. All right, so the Borrelia test would be 325 and 335. Okay, I don't have enough in this article about the enhanced cultures they're doing. They call them, I think, an EQ-PCR, but that would be the other test to look at if you're looking for a direct test method. Okay. All right. All right, let me go back here. Stop share. Okay. All right, let's move on here. Emily's there. Get rid of your questionnaire. All right, hello. Let's see, Karen is telling us she's got a note taker. Got that. Hello, Teresa. How long should one take methylene blue? Good question. So, Teresa, and everyone, methylene blue we use for a couple main reasons in managing this illness. So methylene blue is a well, how can I describe methylene blue? Methylene blue is both a prescription and a clothing dye. So, and because it's a clothing dye, you can find it on the internet. But I would warn you, don't use the internet sources because most of them are not being tested adequately for contaminants, mainly being heavy metals. If you're going to do methylene blue, try to use a compounding pharmacy. You'll have to have a physician write a prescription for it because the compounded versions, they have to verify that their product is free from all the garbage that clothing dye is not free from. Okay, so just keep that in mind if you're trying to buy it on Amazon and places like that. But methylene blue, in addition to being a good clothing dye, is also approved by the Food and Drug Administration in an IV formulation to treat a condition called methemoglobinemia. And in methemoglobinemia, your hemoglobin protein in the middle of your red blood cells does not release oxygen well. And in a crisis, when you need that oxygen, you start turning blue. And if you give IV methylene blue, it literally knocks the oxygen off of that hemoglobin and you get oxygenated, okay? That's the approved reason that the FDA approves it. We now know from laboratory studies that were done out of Johns Hopkins University the last few years, a few years ago, I should say now, that methylene blue is actually effective in the lab at treating growing and persister forms of Bartonella, as well as persister Borrelia. And we assume, based on clinical experience, that it also treats growing Borrelia as well too. So let me just explain those terms real quickly. We now recognize that both Lyme and Bartonella have growing state, and a small percentage of those germs, maybe 5 or 10%, when they've been exposed to antibiotics for a while, may go into a hibernating form. We call those persisters. And in a persister form, they're no longer growing, and they ignore a lot of the standard antibiotics we throw at them, which is why we've been doing a lot of work trying to research and find out what can we use. Methylene blue is one thing we can use. Anyhow, that's where methylene blue comes from. Okay, all right. So how long do you take it? I've had people use it up to a year before. I tend not to see as much GI disturbance out of it. And I've had people that have continued to have good benefit using it for up to a year. It may even work longer than a year. I just haven't used it in anyone longer than a year. Okay, so I have used it up to a year without any difficulty there at all. All right. Yeah, Teresa, did I answer your question? Yeah.
Yeah, can I add something? I think maybe a month or so ago, I asked you about methylene blue because I was doing a lot of research and thinking maybe that's something I might benefit from. And so I went to some Lyme doctor who I wanted to convince to prescribe it. And he's like, well, I never did that before. And I said, well, I talked to Marty Ross last night and he pulled out your book and he's looking it up. And he says, okay, you'll be my first methylene blue. You know what? It is, I mean, I've recently, I mean, at first I thought, oh, am I poisoning myself or am I, whatever. Yeah. But lately the brain fog, I didn't realize what brain fog was until I don't have it anymore.
Yeah.
And the energy, I don't feel like, oh, just let me lay down, all day, or even sitting up here at what time it is, Anyway, I appreciate the methylene blue and thank you.
Yeah. So I want to make a comment about that. So we know that methylene blue, again, can help with this methemoglobinemia. We know it can kill germs, but it also has some added benefits too. And one of those added benefits that you just pointed to is it can improve the function of your cell energy factories called mitochondria. And specifically in mitochondria, the cell fuel that gets produced is called ATP. And one of the processes by which ATP is produced requires a bunch of electrons to be transferred. And eventually those electrons lead to the production of ATP. That complex that transfers these electrons is called the electron transport chain. And oxidation can damage the chain. And you don't get electrons being transported. What methylene blue does is it acts like an electron carrier and can provide a patch to these areas in the transport plane that are injured to pick up electrons on one side of the injury and carry them over to the other side of the injury so that you still get ATP being produced. So having more energy and having clearing of the brain fog may have two parts to it. It may be that you've killed enough germs now being on the methylene blue, but it also may be this effect of helping your mitochondria work better, which is aiding in your better energy and better energy production in the brain. So your neurons work better in the brain and you start thinking better. There's some data on the Alzheimer's disease showing that methylene blue could be an effective treatment in Alzheimer's for that reason, actually. Yeah,
because that's what I was thinking. I even took all the neuropsych tests. I thought I was getting dementia. And yeah, and it's amazing. And I'm only taking 25 milligrams once a day.
Yeah, it's good. I mean, I recommend people go even up to 50 milligrams twice a day, but people sometimes find benefit at even 25 milligrams one time a day. We actually don't know the most effective dose for this. We don't have the studies that tell us. But people tend, in the world of Lyme, we're tending to work on 25 milligrams twice a day up to 50 milligrams twice a day. Yeah.
Okay. All right. Great.
All right.
Thank you.
Yeah. All right. Yeah. I'm glad you're doing better with that too. That's great. Yeah. Does anyone have any other comment here about methylene blue before I move on?
Yeah, Dr. Ross. Is there any contraindications of using methylene blue?
Who is asking this question? I'm trying to see where you are here.
Me, it's Hong. It's Hong.
Oh,
Sorry.
Hong, there you are. Okay, now I see. You got to remember, I've got like a 50 people on my screen. All right. So, Hong, in terms of you asking, are there any contraindications or side effects? I think so. There are some studies in mice, it was mice, where they have shown that it could have some teratogenic effect or cancer-causing effect. But keep in mind, they dose the mice with like a gazillion amounts more than you would practically give a human, basically, right? Relatively, okay? So there is that theoretical risk. We don't have any human studies that saying there is a direct risk in humans, but I want to make people aware because you'll find that. But my argument of that is they use whopping doses on a per kilogram base that you would never use in a human, okay? So just keep that in mind. All right. The other things that we tend to see with methylene blue is it turns everything blue. All right, just be aware of that. And getting it off your toilet can be a little bit complicated. I have found people that use the bar, like your callus scrub, a pumice stone, sometimes will help get that off. I mean, other people have other ideas about that as well too. And then the other thing is maybe about 5% of people will have bladder irritation from it. It'll make it so you pee more often, or you may have bladder achiness. If that gets to be excessive, you can get something called Pyridium, which is a bladder aspirin, if you will, that will help calm some of that irritation down. You can buy it over the counter. You don't need a prescription for it. And then rarely I have had people get intestinal irritation with diarrhea or abdominal pain, but that's rare. That's very rare that I've had that happen.
Mm-hmm. So it basically patches up the mitochondria function, the electron transport chain, but it doesn't repair that, right? It doesn't repair the mitochondria.
It's a good point. You still want to come in behind if you are a person with a lot of low energy that's not getting better after you've treated for 6 to 9 months, assume you probably have some mitochondria injury from all the oxidation damage. And all that the methylene blue will do is patch. It doesn't repair. The repair would be to use the trifortified glutathione, and also to do a product called ATP 360 by Research Nutritionals, which is made up of the phospholipid fats that get injured and a bunch of micronutrients too. And usually, so my way to repair mitochondria is trifortify 1 teaspoon once a day, and ATP 360 3 pills 1 time a day. If you want to read more about those recommendations, I'll just do a quick screen share here to show you.
Awesome.
So this is the article here. It's called Power Up Your Mighty Mitochondria and Get Energy.
Well, let me just do a screen
Yeah,
grab.
I'm waiting for you to do your screen grab.
Yeah, okay, got it.
You got it? All right,
Yeah.
Good. All right. So anyhow, I talk about the glutathione and the ATP 360 in here. Those would be the key things you want to do. I even mentioned methylene blue as a way to patch, though. Okay. All right.
Mm-hmm.
I have a question before we move on from methylene blue. When I try to take it, I feel very kind of off and weird in the head. Do people get that at the beginning, and does that kind of go away, or do people start with lower doses and titrate up?
What I haven't had somebody describe that to me before, but obviously it's doing something to you. If I was managing you, I'd probably have you reduce your dose and see if you can find a dose that doesn't lead to that. And then keep in mind too, even if it's not a dose dependent thing, there are some people with any drug that we give them or any herb we give people. One of my rules, and some of you may have heard this before, is that my rule is anything can happen to anyone with anything. So even though I would not describe what you're having as a common side effect, it may be your side effect, right? So, but I would start it trying to lower your dose first and see if that will make the difference for you.
Yeah, because when I first started taking it, I was getting like hives on my legs, on my thighs and stuff. And I keep getting, I guess this is like histamine overreaction, right? It's probably killing something. And because like, even like if I get warm, if I get hot, I'm like now becoming like allergic to my own sweat. And, it's just getting further and further out of control here.
I would, are you working with a Lyme literate doctor at this point?
I've tried to work with, so I think I actually crashed in mold. I know I had pre-existing Lyme now, and I was in a house with mold that tore me up pretty good. And I did an HLA-DR gene, and I'm only mold susceptible on that. But it's kind of like the chicken or the egg, right? But at some point, I got tipped over, and I'm having all sorts of histamine and all sorts of problems.
So Sean, what I would quickly tell you to take a look at, you probably have seen it, but I have an article on mast cell activation. I would look at that. It is very possible that having tick-borne infections with mold toxicity has overstimulated your mast cells. We know they can turn them on, okay? And obviously killing germs is triggering more mast cell. You got hives from that and blisters. I would look at doing things to stabilize your mast cells. So look at my article. It kind of lays out an approach to do that, okay?
All right, cool. Thank you so much. I appreciate you.
Good luck.
Yeah, I'll need it.
All right, let's see here. So move on here. Okay, next one's from Sandy. Let's see, can I take interface plus enzymes and EDTA at the same time as lumbrokinase, nattokinase, or will it counteract it? Let me just look. I think you're fine doing it, but I have to remind myself of what interface plus is. Bear with me. I'm going to do a screen share so you guys can see as I look this up at the same time.
I know it has enzymes and it also has EDTA, which is a chelator. And so I'm curious if the chelator would affect the nattokinase or the lumbrokinase.
So this is the clear, ooh, I hate going to Amazon, but all right, let's see here. So it's got in it the EDTA you were talking, it's got various enzymes. Got it. All right. I see no reason you can't use that with the other enzymes.
You don't think the EDTA would bind to it? The EDTA wouldn't bind to the lumbrokinase or
well, that's a good question. So your lumbrokinase natto or your the EDTA is going to bind minerals. Your lumbrokinase and the nattokinase are proteins. So it should not bind to the lumbrokinase or the nattokinase. But I'm trying to think of the other question. Would the lumbrokinase nattokinase destroy the EDTA? Sandy, I have to look into this. I don't honestly know. I haven't had somebody try to do this combination before, but I don't know off the top of my head.
It's so difficult to wait the appropriate amount of time in between things. So that's why I was hoping to take those two together.
I just don't know. I don't know.
Okay, thank you.
All right. All right, let's see. Kelly, Happy New Year, Marty. Hello again, Kelly. I think I already said hi earlier, but yeah. I plan to participate in Dr. Breitschwartz's Triple B study at North Carolina State Veterinary School as I feel the more advanced testing may spot Bartonella missed by IGeneX. I've been on the biocidin since May of 2024 and wonder if that will impact the testing results one way or another. My naturopath and I were thinking of tapering off to see what happens, but I kind of wanted to wait until I start working with Dr. Letitia in a few months and get her opinion. I want to do Ed's testing now, though. Do you have any thoughts on whether I should stay on biocidin during the testing? Ed says, I doubt that biocidin will eventually affect the test results for those interested. All right, so What is he doing with his study? I'm just going to click here, and I'm going to look here real quick. Let's see. I'm still here, everyone. Oh, I should do that as a screen share so we can look at it at the same time. Let me go back here. Let's do a screen share here. Okay, this is just a quick write-up on what he's doing in his study. It's a pilot study.
Yeah, so I'm putting
he's going to be doing a PCR test. All right, so here's what I would, let me go out of here. So what I was trying to look and see is, what is his testing technique going to be? I thought it would probably be a PCR. So PCR, again, is a direct test to see if you can measure the germ in you. Okay, it's looking to see if you can see the DNA. The trouble is with when you're doing DNA testing, you want to have the greatest chance that the germ will be there. If you're taking something that could kill the germ, it may lower the amount of germ that's available in the blood to be tested, basically, okay? And when you look at biocidin, biocidin has multiple herbs in it, but the herb that the concern I would have is it has some essential oils in it. I believe I think it has oregano oil in it. It also has garlic in it, and both of those can kill Bartonella. And so they could kill the other bees that he's testing for as well too. So I would probably not be on it. And Dr. Ed may not have been familiar with biocide enough to make that comment, but I would not be on it.
Now, if because I think we've established clinically that Bartonella is probably part of my situation with the severe OCD. If the biocidin, the OCD is pretty severe. If the biocidin was helping at all, I do think maybe it helped some of the GI stuff. Are there risks to going off of it? My naturopath and I kind of weren't really sure, and I'm taking it twice a day, and I'm probably going to be adding in more things. So that's part of why we had already been thinking, should we see what happens off it? But then I'm going to go to Dr. Letitia, and she really knows this stuff. So I don't know.
Yeah. So remind me, I think you had SIBO, if I'm remembering correctly. Is that right? Small intestinal bacterial overgrowth. That's why you were on the biocide.
I had that in 2023. I didn't start going to this, and it may have reemerged in 2024, but by the time I did an official retest, I had already started taking things. So
So let me tell you, it's going to be kind of tough. It's a hard answer. There's not a perfect answer here. So the issue is, I would not call biocidin the strongest way of killing Bartonella. What I am saying, though, is that some of the components can kill Bartonella. Okay. On the other hand, if they have helped Bartonella at all, you do face the risk of germs regrowing, being off of something that's helped the Bartonella.
Right. I guess I guess part of the appeal of this test, and I had actually just reached out to this Ed guy because he's really
he's the guy.
Know about him. Yeah. So I had just reached out to him for insights. I didn't realize, and then he was like, "Oh, you could probably be in my study." And he said something about it would be important to I guess how important is it to get having OCD in particular, and I'm sure a lot of people with chronic illness relate to this as well. I feel like, oh, am I just chasing another label? On the other hand,
I understand
20 years of delusional experiences. So it's how important is it to see is there Bartonella?
Because Bartonella can be hard to treat in some people.
Yeah.
And especially if you've got mental illness and you're probably trying to please parents who may be helping to pay for things, etc. Sometimes it does make sense to get a positive test. All right. Does that mean you don't treat if you have a negative test? No. But it depends. We get testing for reasons. One is to help confirm diagnosis, but we also sometimes have to use it for the politics of the whole thing. And then finally, if you're treating and you're not getting better, you're going to start questioning, is it really Bartonella? So having a positive test kind of gives you the the proof you need to keep going further in treatment if it's not going well for you.
Right, right. Do you think maybe it would be worth Dr. Letitia's just hopefully soon at getting licensed for Maryland, which is where I live, and then I hope to start working with her because my naturopath isn't super Lyme or literate.
I think it would be reasonable to wait to talk through with her. Yeah, and see what she's going to want to do for testing with you as well too. Yeah.
Okay. All right. Thank you. I appreciate it.
Yeah. Good luck.
Thanks.
All right. Let's see here. Okay. Let's see. Lee, I'm hoping you can comment on both vision and breathing issues. In regards to vision, I have developed a convergent insufficiency and have extreme light sensitivity, especially with artificial light. The optometrist says he's only seen this with mold exposure. As far as the breathing, I am very familiar with air hunger, Lyme, and mold toxicity, but this latest bout has been relentless this last month and a half. Do these sound like mold-related symptoms? I'm working with a cardiologist and pulmonologist. Okay, so in terms of what could be leading to neurologic problems, which is convergence means you're having a hard time bringing your eyes together, that's going to be impacted by the nerves that make the muscles in the eye move the eyeball. Okay, so that means you've got some neuropathy going on. All right. Light sensitivity means neurologic, probably inflammation or hypersensitivity in the brain. Of the infections, both Bartonella and Borrelia may be able to do that. Often Bartonella more so than Borrelia, and mold toxicity could do it. So, and I don't agree with your optometrist that it could be just mold toxicity, because I have seen similar situations in a patient that had Bartonella and Borrelia. All right, so on that part of things, okay? In terms of air hunger, I often do not see air hunger in mold toxicity. What I tend to see air hunger in is either in Babesia or in Bartonella. And that is in Bartonella, we think it happens because you get inflammation of the cells that line your red blood cells. And as they get inflamed, they fill in the opening of your red blood cells, which limits oxygen going to your lungs, and you feel hungry for air because you literally aren't getting enough blood flow to absorb the oxygen into you, all right? Babesia also can give air hunger, but more because it lowers your red blood cell levels. But given all that you've just said here, the convergence insufficiency, light sensitivity, air hunger, which probably your cardiologist and pulmonologist will not find a cause for your air hunger, I would start wondering about Bartonella with you. All right. And that's just me, a brief snapshot here, but this is something I would be talking with a Lyme literate doctor to see if they can help you look at that further. Okay. Lee, did that answer your question for you?
Yes. Thank you very much.
All right. Good luck, Lee. All right. Let's see here. Hello, Mindy. Let's see. Could you please talk about getting severe, scary muscular contractions that last for sometimes greater than 15 minutes and cause extreme pain, weakness, inability to move? Is this common with any detox from mold, candida, etc.? With these spasms, what is often the root cause? What are treatments, slow detox, open detox pathways, any specific testing you suggest? At what point should you go to the ER? So when I think of severe cramping like you're describing, I'm thinking either neurologic irritation causing, with your irritated nerves, sending signals to your muscles to contract, okay? Or I'm thinking of magnesium deficiency. So if you were my patient, I would start by trying to make sure you're taking about probably about 400, maybe even up to 600 milligrams at night of magnesium glycinate. I would choose the glycinate form because it tends not to lead to diarrhea the way that some other forms can, okay? All right, so that would be the first start. If that doesn't help, then I would start wondering about neurologic irritation sending signals to cause the spasm of your muscles. And I might look at, well, first of all, you want to treat the infections and mold toxicity that could lead to that. So if you have Borrelia or you have Bartonella, treat them. If you have mold toxicity, get the toxins out, okay? And in addition, I would try to decrease neurologic inflammation by being on the curcumin I mentioned earlier tonight, 500 milligrams 3 times a day. And I would try to be on the glutathione that I mentioned earlier, Trifortify, 1 teaspoon a day. That's just to get the inflammation of the nerves down. And then finally, I mentioned L-theanine earlier tonight as a way of quickly calming your agitated nerves. And I would consider to start dosing about 100 milligrams to 200 milligrams 3 times a day to raise GABA levels to decrease neurologic irritation. That would probably be the approach I would do. In addition, I would want to get basic blood studies on you, like a complete blood count, a comprehensive metabolic profile to see how your kidneys and liver are working. I might even get magnesium levels on you as well, too, to see where they are. Okay. That would be my approach, but definitely talk it over with your physician as well, too. Okay. All right. Mindy, did you have any questions there?
No, thank you so much. I was just wondering, it seems to happen when I'm trying to detox. I've been trying to detox Candida, and I wondered if taking nystatin 2 pills twice a day plus antifungals would be the reason. It's just too much for my body.
Well, it could be that you're getting a great, when you move toxins or you kill germs more, you can trigger more cytokine inflammation, which could lead to more inflammation around your nerves, causing this to happen. So I would definitely do everything you can to control cytokines, which are the curcumin and the glutathione I mentioned earlier. And then you may want to be a little more cautious about the intensity of killing yeast that you're doing too.
What would cause them to pick the front of the ankle as opposed to another spot on the body?
I can't explain that. Unfortunately, I don't know why. There are so many things that how Lyme and tick-borne infections and all these infections present in each of us is so uniquely different than other people, and there's a lot of stuff we just don't understand why it happens.
Oh, all right. Thank you so much. I appreciate that.
Yeah. Good luck, Mindy. Yep.
Thank you.
All right. Hello, Meg. Let's see. I've been treating on and off for years and continually now for a year and not getting better. I'm treating for BART, Borrelia, tick-borne relapsing fever, possibly Babesia, although all tests have been negative for that. I'm currently taking a ton of supplements and methylene blue, doxy, clarithromycin, atovaquone, cinnamon clove oregano, Baluchi, etc. I just added in rifabutin and felt better for a day or two, but since then, all my symptoms are very aggravated. I'm lost. Any suggestions? Oh, Meg, I'm sorry. I know you've been through a ringer. I know you and I have talked before too. To really figure this out, this would be like a 2-hour visit with you, because I would really need to know how you got here. And I know you've told me bits and pieces over time, but I just don't have enough of it. I can't hold it all in my brain, right? The only thing, thinking beyond infections and just thinking of a few other things to think about, okay? And again, I can't give you a thorough answer without doing a thorough visit, but for some people, their illness can become a holding pattern held by the limbic system of your brain. And you may have heard of something called, so the limbic system is a part of your brain that controls adrenaline release and not release, and it can actually become overactivated. And so you probably have heard of something, Annie Hopper's dynamic neural retraining system sometimes can help retrain that area of the brain. There's the Gupta method. There's a number of methods you can use to help to deal with that. Okay, so that's something for you to think about. Okay, the other thing that you may want to consider is, unfortunately, when you have these tick-borne infections, they may trigger the development of what are known as senolytic cells in your body. So, I'm sorry, not senolytic cells, senescent cells in your body. So all of our cells are supposed to divide and have, I think, are programmed to divide up to 220 times. And all of our cells, once they stop dividing at 220 times, will become senescent. That's natural senescence, okay? But having a lot of oxidative stress, like in having chronic infections, can cause your cells to stop replicating as well too. And when they become senescent, they turn into hyper-functioning cytokine production factories. So they just keep pumping out all these excess cytokines, and the body can't get rid of them. They actually upregulate a bunch of proteins that make it so the immune cells will not come in and break them down. So one thing that can be helpful, I've mentioned, there's an article I have out on it, which is, there's a couple articles I'll show you that you may want to consider this, okay? Doing a fasting mimicking diet, which is being on a diet that's called a fasting mimicking diet. It's made by a company called Prolon. It has in it, you eat minimal calories for 5 days, and the composition of the calories, the amount of fats, proteins, carbohydrates they have, do not trigger your body to think you're getting food. So it goes into a fasting state. And in a fasting state, you get rid of a lot of these senolytic cells. You also help your cells reprogram unused parts through a process called autophagy. You rejuvenate your cells, okay? So that's one possibility you may want to consider doing. The other thing, if you don't quite feel like doing that, there are herbal chemicals you can take that are called senolytics. And the two senolytics that can be useful are to use something called fisetin and quercetin. And we're trying to settle on the best way to do those, but we think doing them for about 3 days every 2 weeks, and you would do it as 500 milligrams twice a day for 3 days in a row, take time off, go in and do it again. Just start adding that into your regimen. That can help get rid of the senolytic cells. It'll take time, okay? And then to promote autophagy, this repackaging of unused dead parts in your cells, to do that using a supplement called spermidine. And spermidine comes from wheat germ, but you can get it made in a way that doesn't come from wheat too. But spermidine triggers autophagy as well too. And you want to take about 16 to 20 milligrams of spermidine once a day. Now, I'm mentioning these to you because in some ways it just may be that your body is stuck in a inflamed state, that may just be there now on its own because of senescent cells and because of not having cells that have been able to clean themselves up, okay? So two things I would look at, and it's not a comprehensive enough answer for what's going on with you, but if you have not tried these other things, you might want to look at them as well too, okay? All right, and let me show you a couple articles where you can look at this. Okay, let's see here. All right, so let's see. Go here. All right, take a look at this article called "Why Chronic Lyme Treatment Fails: A Review of Strategies." Okay, and in here I talk about where are we here? I talk about the limbic system, and I have links to this Gupta program and the anti-hopper program, okay? All right. And then in terms of these senolytics and autophagy that I was just talking about, take a look at this article called Longevity Interventions for Chronic Tick-Borne Infections and Mold Toxicity, all right? And it talks about what I was just telling you about. And then in terms of the diet, this fasting mimicking diet, if you are interested in trying that, you can find it here on this Prolon diet page. And I have an affiliate relationship with Prolon where if you click on my link, you get it at a discount as opposed to going to buy there directly. Okay, so those are some things for you to think about at least. All right, Meg, do you have any questions about that?
No, I actually am doing brain retraining with Reorigin, which the founder of that was a Lyme sufferer, but I haven't noticed it's been helping. So
yeah, take a look at some of the senolytic stuff. I know talking with You may be familiar with the name Dr. Kent Holtorf. He's the guy that came up with integrated peptides. He's got a clinic out in California.
Yeah, I've heard of
And
him.
he's been talking about, we were at I get that last ILADS conference. He was talking about some of the benefits he's had from adding in senolytics into his treatments with some of his patients that are really stuck. So something to consider at least.
Right. Thank you, and Happy New Year.
Yeah, thank you. You too. All right. Kelly, I see your hand up there.
Yes, two quick follow-up questions. Well, one of them's not quick, so feel free to defer me, but how do you spell that? Senolytic?
Senolytic. SENO LYTIC.
Got it.
And it's in that article, the article I showed you about longevity interventions for chronic Lyme disease.
Oh, okay. And then I was so having primarily mental health challenges, I too am familiar with brain retraining stuff. I've been a little hesitant to go there. I mean, I've been so busy just with the testing and stuff, but also because having done cognitive behavioral therapy for 20 years for CD, and now realizing there was unrecognized, tick-borne stuff, autism.
Right.
There's some trauma that has happened. And my naturopath even casually used the word gaslighting about some of those programs, that are sort of. So
there is gaslighting that happens in this illness.
So I'm just kind of wondering, and again, feel free to route me somewhere else, but the other thing that's rolling up on that side of it for me in terms of limbic retraining is sort of I don't know the right term, even fascia, musculoskeletal things. And so my naturopath told me about a physical therapist who's very much into these kinds of worlds and can check to see the dura, the casing around your brain or something. They can kind of get a sense of what the damage is, or you could do things like craniosacral fluid mobilization. So anyways, my question is, there's that whole side of it, your somatic and body work, and I'm almost encompassing the brain retraining programs in that in a way. How does one, in that potpourri of that area, how does one figure out what's best for you, if anything?
So I would not, if you have active tick-borne infections or if you have active mold, it's too early to go to doing the brain retraining stuff, because it may not even be, we tend to think of doing that when we've treated somebody for a year, 2 years, and they're really just not getting well. Then you start wondering, could be a holding. Okay. In terms of, working on fascia and connective tissues and all that, the problem I have with that is if you have active infections and you get in there and start stirring them up by doing all the pressure kind of stuff, it may make you worse at first too. So I generally do not go that direction, either one of those directions early in a treatment. Those are things I might think of later down the road.
Okay. And again, someone can have active infection without necessarily having positive IgMs. Again, I know that's
absolutely.
Okay.
Absolutely. Yeah.
Thank you.
All right. Listen, I'm going to take Monica's question because I know she wrote to me through Lyme United today a couple times, and I told her that I would try to get to it today, and we're already about 6:23, so I'm just going to take a look at this one. I'm jumping ahead in the queue here, everyone. Let's see, about the Zenmen tick immune support, I would like to know if the herbal content of the product is sufficient to destroy primarily Bartonella. It suggests takes 3 times daily for 3 months continuously. Here's the link. All right. So I did look, Monica, earlier at the Zenmen product, and I will tell you, I honestly don't know. I don't know from experience. And the trouble is with a lot of these herbal compounds, you've got to try it to see if it's going to work. A number of the herbs that are in the Zenmen, like the Japanese knotweed, the cat's claw, I believe there is Chinese skullcap in there. Those are, the cat's claw will have nothing to do with Bartonella. It will be useful against Borrelia. The skullcap, I don't even, let's look at this together. I'm going to do a screen share here. Look at this together here. I don't think of skullcap as being Bartonella either, but let's look at it together. Okay, so I have a whole table here. Where is skullcap? There it is. Yeah, so skullcap is going to be useful for growing persister and biofilm Borrelia. In laboratory studies, does not have any activity against Bartonella and may have some activity against Babesia. That's what the laboratory studies tell us, okay? So regardless of whether what's in it is strong enough, the only real ingredient in there that's doing anything for Bartonella is going to be the Japanese knotweed. The other two main components, which is the skullcap and the cat's claw, are not going to be useful for Bartonella at all. So if your aim of doing this is Bartonella, that's not where I would go. Second thing I would tell you is I don't know whether the strengths that are in there are strong enough or not. I have to have practical working experience with it to tell. All right. Monica, are you still here with us? All right. All right, let's see where I left off here, everyone. Oh, Monica, you are there.
Yes, sorry, I did hear everything you said. Yeah.
Did you have any further comment about what I said?
No, but I can tell you a few more things that are in it. These black walnut, sweet
When I
worm.
looked at this, yeah, let me see if I can find it again. I looked at this earlier. Where is it here?
I provided the link and it'll show on there what's in the bottle, what's in the product.
Can you put the link up? And then we'll all look at it together.
Have a look.
Oh, there it is. I see it.
Yeah.
I see your link here. All right. Oh, I got to go back and do a screen share. Hold on a minute. Okay, so this is the Zenmen.
Yeah.
And in terms of what is in it, where are we here? There's your product label. Okay, so it's got knotweed, cat's claw, skullcap. Oh, okay, I'm sorry, I misread that. So here, so you're in this, the knotweed and the crypto would be your main. I wouldn't say the rest of this is strong for Bartonella. I think the knotweed and the crypto could. What I would tell you is I don't know if the strengths that are in here are going to be sufficient or not. I just don't. I don't have the experience working with this product to know.
3 times a day are the recommended dosage.
Yeah, the only way I could comment about that is if I had used it myself to see if I saw responses of people, and I don't have it from experience. Okay.
I'll use it and see what happens. Treat myself like a guinea.
Yeah, let us know. Let us
I
know.
will.
All right. Thank you. All right. Let's see. David, let's see. Will ketoprofen work for calming down the nervous system as well as dealing with cytokines? So ketoprofen is a antihistamine and mast cell stabilizer. So when you have mast cell activation, what happens is these cells called mast cells, where histamines are made, that usually will release histamines when something you're allergic to lands on them. They actually start overproducing and releasing histamines separate from allergies, all right? And what seems to turn them on to release these histamines is infections, yeast, mold toxicity can turn them on. And so what the ketoprofen will do is it does 2 things. It stabilizes them so they don't release as many histamines. And in addition, because it's an antihistamine, it will block some of those histamines at the histamine receptors. So it can help. So histamines, excess histamines can agitate the nervous system. And so it will help with that part of things. However, ketoprofen is not something that would necessarily work on cytokines, to answer your question, okay? David, did you have any other comment there? All right, let's see what time. Yep, that's going to be it for me for tonight, everyone. Listen, it's been good to be with you here on the road in Colorado Springs at my dad, where it snowed today and it's 20 degrees outside. And for somebody that lives in Austin, Texas, this has been a bit much. But anyhow, so, but anyhow, look, I will do my best to get the recording of this up tomorrow morning. Probably, I'm actually going to start driving back to Austin tomorrow, but I'll probably drive for a bit and then pull over and get this taken care of and get it put up for you. So look at that tomorrow morning, and then please do RSVP for next week's webinar as well. All right. All right. Good night, everyone.
Thank you.
You're welcome.